Today, rapidly advancing orthopedic treatments are boosting the quality of life for countless Americans, especially baby boomers who are eager to return to their normal activities. Joining me now is Dr. Gordon Newbern. He's an orthopedic surgeon at the Arkansas Specialty Orthopaedics in Little Rock. Also, we have Ellen Sullivan. She's a baby boomer, and she had a knee replacement just 14 months ago. It hasn't been long at all. I want to thank both of you for being here. And I guess, Dr. Newbern, I want to start with you. One of the things you said just really, my ears perked up. You said that the number of hip and knee replacements will increase 600%?
600% over the next 25 years.
Why?
Due to this large number of baby boomers that are coming down the pike that will need care.
Is it because they're baby boomers and there are so many of them, or is it because they're active baby boomers that are wearing out their joints?
I think it's both things. This generation is a more active generation than older generations have been, and they've been very active, and they're wanting to maintain that lifestyle. And so they are probably wearing out joints perhaps a little bit earlier, and they're expecting to be pain-free and to be mobile for longer and earlier, and they don't accept slowing down like perhaps older generations have. Also is the large number of baby boomers. It's just a big a bulge of people that will be coming down through the medical system.
This is just absolutely amazing to me. And the amount of time required to heal, you know, you can talk more about that, because right after your surgery 14 months ago, when you had your knee replacement, you were up that day walking on this new knee. That to me is just incredible.
I had no choice. Physical therapists came to get me and said, "It's your turn." And I got up and went.
Did it hurt?
I didn't think so at the time. Of course, I had some very good drugs that day. I was still in the hospital.
Drugs always help.
But yes, physical therapy is tough. It's not a cakewalk, but it is very doable. And I was determined to make it work and do what I had to do, because I had things to do.
All right. Well, Ellen, before we get into that, and I know, I'm sorry I'm asking you this. How old are you?
I'm 55.
You're a baby
This
boomer.
is my 55th year.
Okay.
Yeah.
And you used to run.
Yeah.
You were very active. What kind of activities did you do before?
I played 30 years of hard tennis. I rode a bicycle, a motorcycle. I did everything there was to do. Played basketball. Just was very, very active.
And then suddenly, what, you started having knee problems?
It really wasn't sudden.
Okay.
It came over a long period of time, and it would ache, and then it would get better, and I would do the ibuprofen thing, and I would do the heat thing, and just slowly would never go away, and there was a constant ache. To the point that I would have trouble sleeping at night.
Oh, really?
Yes, it was really bad. So in my regular yearly annual physical with my GP, he said to me, you know, maybe I should send you to an orthopedist.
GP?
Yes.
GP stands for?
For my general practitioner,
okay, gotcha.
my family doctor.
Yes.
He said, let's go see an orthopedic, and sent me where I am today. And one thing led to another, and I found out that I had osteoarthritis. And we actually had done a scope, hoping that that was going to take care of the problem, and it really didn't. It just didn't get better. And so I said, I want to do this while I'm healthy, and I'm strong, and I have plenty of time, and I want to do it.
Didn't you have any reservations at all,
No.
though? I mean, because when you think about, you know, I mean, no longer your knees. I mean, we're talking some foreign object, which we'll get to look at in a few minutes here, Doctor, placed inside of you, and the surgery and all of that. A lot of people shy away from surgery, and it's like, oh, I'll just keep taking the pain medicine. I'll walk less. You know, I mean.
No, that's just not my lifestyle. I'm a nurse practitioner, and I'm certainly aware of what's available, and I knew that I could retain my busy lifestyle, and I had every intention to doing that. I'm just not going to sit down, and I don't want to take medicine for the rest of my life. I want to enjoy
So
my
you're
life.
not taking medicine at all now?
No.
And your knee doesn't hurt one bit?
Zero pain. Zero pain.
Wow. Stay with us. We will continue our discussion on hip and knee replacements and baby boomers, and hear the wonderful story that Ellen is telling us about this. We'll be right back. Patients who fit these criteria usually need more effort at treating their pain and more conservative measures. We've been talking with orthopedic surgeon Dr. Gordon Newbern and his patient Ellen Sullivan, a baby boomer who underwent the knife to have a knee replacement 14 months ago, and it's working out very, very well. I know Ellen said that she had osteoarthritis, but there are other illnesses or, things that people have that would force them to have a hip or knee replacement. It's not always osteoarthritis, is it?
That's correct. Other causes are inflammatory arthritis.
Okay.
The one that most people know of is rheumatoid arthritis. There's post-traumatic arthritis, where you've had a fracture or a bad injury to the cartilage surfaces or bony surfaces of the joint.
Mm-hmm.
There are some less common causes where you lose the blood supply to the bone and the bone collapses and becomes soft. It's called avascular necrosis, but that happens as well.
It's really interesting how so many of them, though, are associated with arthritis. And you talk about the increase of 600% among baby boomers. I can remember, growing up and, listening to parents and grandparents, and they're complaining about their arthritis and how it just hurts and it hurts and it hurts. But they really didn't have the option then to get new knees or new hips and that sort of thing.
Well, that's right. It was in the 70s that we really started getting good models of joint replacements in the very beginning. And even those didn't last that long. They might last 10 years, 15 years at the best outset. So these younger patients that we're now fairly routinely doing joint replacements in, we would not have advised to do that with that older technology. But as we've understood the procedure and perfected it, and the materials have gotten better and more durable, we're able to do it in younger patients and expect it to last a real long time. And that's been a real advantage.
That is wonderful. You brought some examples here of some, I guess this would be a knee replacement, correct?
Yes, this is a model that shows an arthritic knee, just a kind of a plastic markup of that. And you can see this cartilage is healthy and white and smooth, but you look in the other areas, and this is a sort of an artist's example of where the cartilage is eroded away, and there's just pink bone underneath the cartilage. And so this is what osteoarthritis would look like.
Okay, okay.